Dear colleague, dear friends, it's a great pleasure to welcome you to this new education activity of EAHAD that will focus today on women's health issue in thrombosed hemostasis. And the focus will be on menstrual problems associated with inherited bleeding disease. So this podcast will be given by Dr. Karin van Galen, who is hematologist at the Van Creveld Clinic in the Netherlands. So Karin, welcome.
Thank you very much. Thank you for having me.
Thank you for giving us a little bit of your time to echo and give our colleagues a short summary of the content of your slides and your recent presentation at the EAHAD Academy. So maybe I could ask you a first question. What's the current epidemiology of heavy menstrual bleeding in women?
Well, that's a good question to start because actually we don't really know. There's a large gap between what women report on the occurrence of heavy menstrual bleeding and what is seen at the clinics. So it is estimated that for women, approximately 1 in 4 will at some time in her life experience heavy menstrual bleeding. So that's probably a huge problem, but it's not what is being seen by healthcare professionals. In adolescents, it's a little less clear how often it occurs. If you ask them, adolescents do approximately 1 in 3 say that they have heavy menstrual bleeding, but some estimates say that it should be approximately 1 in 10, but we actually don't know. It hasn't been investigated so well.
Thank you. And in your view, so clearly there is a lack of diagnosis, there is a lack of awareness, but what are the current challenges with the diagnosis of these heavy menstrual bleedings?
So the main challenge is, of course, the underdiagnosis and diagnostic delay for heavy menstrual bleeding. There's some reluctance in women to visit a clinician for their menstrual problems. And what is also a challenge is that it's quite difficult to reliably measure menstrual blood loss. So we know that reported menstrual blood loss is not very reliable, and we have some tools to measure blood loss, such as the PBAC, but it's still a bit subjective. So those are our current challenges. And if women don't visit their doctor for heavy menstrual bleeding in the first place, then it's even easier to miss a diagnosis of a bleeding disorder, which might be an underlying cause.
Certainly. And in your view, what would be the strategies that could help to improve the diagnosis of this bleeding disease? So, clearly, I invite our colleagues to watch the full program and your great slides, but just to share a quick summary.
Yes. So first of all, patients should be educated on heavy menstrual bleeding. So what is heavy menstrual bleeding? And we can use the 7-2-1 rule. That's very clear and simple to remember. So if you menstruate more than 7 days, if you need to change your pad every 2 hours or more often, or if you lose blood clots larger than €1 coin, then that's heavy menstrual bleeding. And especially if it's disrupting your social life, that's an important reason to visit a clinician. And then, second, the clinician should be aware that there might be an underlying bleeding disorder. And the first thing that this healthcare professional who sees this woman has to do is take a bleeding history. And there's a lot of education to do also on this part. We've seen this in our own general practitioners population, that of the adolescent girls with heavy menstrual bleeding visiting their general practitioners, only 1% received coagulation screening tests in the laboratory.
Well, clearly a lot has to be done. And in your slide, you also try to summarize what would be the ideal diagnostic pathways that you would recommend. What would they be?
Yeah, well, actually, there should be 2 sorts of diagnostic pathways, both one to help your referrals come in. So that should be in the first and second line for the healthcare providers to assess women with heavy menstrual bleeding for a possible underlying bleeding disorder, and then refer them to an HTC for further diagnosis if there's a suspected bleeding disorder. And the second pathway should be within the hemophilia treatment center for girls and women who are already diagnosed with a bleeding disorder and who may experience heavy menstrual bleeding. We should ask them actively, because they might not come up with it themselves. For example, because they normalize their abnormal blood loss, it's normal in their families. Then we should have really short lines with the gynecology so that we don't miss underlying diagnostics, gynecologic causes of heavy menstrual bleeding.
Certainly. So clearly we discussed the issue of awareness, the problem with diagnosis, and then let's move to the management. And in your slide, in your presentation, you made a very clear distinction between the acute setting and the chronic setting. So maybe you could summarize what would be the priorities, both in the acute and chronic setting.
Yeah, so when a woman or girl presents with an acute heavy menstrual bleed, then she should be presented at the hemophilia treatment center or the ER, so that she can be treated as having a large bleed. That's important from our perspective as hemophilia treaters. And then again, at that time, also the gynecologist should be involved, because there might be a local problem, or there might be additional hormonal treatment or interventions needed to stop the bleed. That's for acute heavy menstrual bleeding. If it's chronic, first objectify it with a PBEC score, because they may say it, but it's not that clear always. Of course, if they have iron deficiency or anemia, it's already clear. And start treatment soon. Start with tranexamic acid, that's first line treatment. And then second line, combine with hormonal contraceptives. The progesterone IUDs are very effective, or just a combined oral anticonception pill. And then this is also in collaboration with gynecology. If this first line treatment does not work well, maybe you should intensify your coagulation correction, for example, adding DDAVP, desmopressin, and discuss with the gynecologist if there are other options or local problems that cause the heavy menstrual bleeding.
So, well, clearly there are multiple options, both in the acute and chronic setting. And then in the second part of this education activity, you went through very nice clinical cases. I think clinical cases are really informative, because they really reflect, what we could see in our clinics. So we won't have time to go into details of each of these cases, and I invite our colleagues to watch your lecture. But what would be the key messages of these cases that you selected and that you could summarize now?
Yeah, so every case on itself has a lesson. So I would certainly encourage people to see these presentations. They are real life cases, all of them. And what stands out is the diagnostic delay. So that's important. Timely diagnosis and treatment, that can spare a lot of misery. And furthermore, also discuss about sexuality, because if these girls are not prepared, there can be a lot of traumatic experiences that are not needed. So we should educate them. That's very important also.
Thank you. No, I really enjoy listening to how these cases were managed by you and your team. Also, in your presentation, you highlighted the major gender inequality in our healthcare system. This is certainly a topic that is deserving a lot of attention. And I think this is great. And it would be nice if you could share your views about this.
Yes, this is especially true, unfortunately, for women with bleeding disorders. And this has two causes, in my opinion. First, of all, it's historically that in our hemophilia treatment centers, it was mainly male-oriented because hemophilia is mostly a disease that affects males. So that's one of the reasons. And the second reason is the big stigma on menstruation. And yeah, people are reluctant to talk about it. And there may also be social issues that affect this. So there's a lot of work to do here to close the gap.
And have you got the impression that the situation is improving, considering the multiple initiatives that have been initiated to improve the situation in your center? Have you seen a difference over the last 2-3 years?
Sure, certainly. And we have last year published Principles of Care, 10 Principles of Care for Women and Girls with Bleeding Disorders that can be used in hemophilia treatment centers to optimize care for women with bleeding disorders. And it's improving and research is starting, but it's very little has been conducted at the moment yet. So we need to do a lot more.
Certainly plenty to do.
And then in your presentation, you also try to summarize the results of important clinical trials on this issue. Could you summarize them quickly? What are the key conclusions?
So, well, the reality is actually that few trials have been conducted. So, especially not only for women with bleeding disorders, because there are very, very few, just a handful of trials, and mostly they even used insufficient outcome parameters or insufficient treatment strategies. So they are not even so good to evaluate. For example, we don't even know whether clotting factors are useful in treating heavy menstrual bleeds. There's insufficient evidence to say so. But also in women without a bleeding disorder, there's even only low quality evidence that combined oral contraceptive pill is enough to treat heavy menstrual bleeding. And most evidence is there for NSAIDs. And we all know that NSAIDs in people with bleeding disorders might not be a good idea. So while they affect the platelet function, so we don't know actually what the best is to do. But tranexamic acid has a good case that's working quite well, and also the progesterone IUD.
Yeah, so these are commonly used treatment options, but could you elaborate a little bit on what we could expect in the future? Do you see other new treatments that could help this woman in the future?
I don't know. There are some. There's been one study that's exploring a new treatment agent, but it's not being followed up. So I currently don't see that there's so much new on the horizon. But with the current treatments that we have, we should do more research to see how we can use them most effectively and in which order and what together and what not. So combining tranexamic acid with DDAVP, for example, seems a very promising method to control heavy menstrual bleeding. And in clinical practice, that's also, in my experience, the case. So that's one of the things that could be better used.
Yeah, and maybe there is another group of patients. These are the patients who have bleeding symptoms, and then we perform all the tests that we can, and we do not find any abnormality. So these are patients with bleeding disease of unknown cause. This is an entity which is increasingly receiving a lot of attention. So could you elaborate a little bit on this? Because I think that in your presentation, you also addressed an important study that was recently published on this, looking at the quality of life of these patients.
Yes, that's right. And we all know that heavy menstrual bleeding affects quality of life and also can disrupt your social participation, which not only affects physical health, but also maybe financial and career perspectives, which we have also heard from women with bleeding disorders in the surveys of the EHC. Literally missed opportunities because of frequent absence due to heavy menstrual bleeding. And what this quality of life study said, it was about a bleeding disorder of unknown cause. And compared to other mild bleeding disorders, heavy menstrual bleeding this occurs as often in these mild bleeding disorders of unknown cause, and they also affect quality of life in the same manner, and it's lower compared to the general population. So we should treat them the same way as other women with bleeding disorders who do have a clear diagnosis.
And I think this is an important message, because it's not because you do not find a clear diagnosis that you should neglect. I think you should offer this woman the same type of care and treatment options. I think this is important. So I think that we
totally agree.
So we covered many aspects. So maybe, since you are really passionate and really active in this field, what would be, your take-home messages that you would like to share with our audience? Important, messages.
So first of all, be aware of this problem of heavy menstrual bleeding. Ask for it actively. Educate your patients on it, and so they are prepared. Also, when they have the first time sex, they should know what to do and how to act. The hemophilia nurse can play a role in this, in educating the girls. So this is important, and treat as soon as you diagnose heavy menstrual bleeding. Don't let those women walk away with it, and also be very aware of the iron deficiency, because that can also cause a lot of symptoms, and it's easy treatable. So don't forget that.
Well, thank you, Karin. Well, thank you for contributing to this educational activity. I know that you are passionate about this topic, that you are very motivated advocate working closely with the patients' organization to help all these women. Many of them have been ignored in the past. So I hope that this education activity and the podcast today will give echo and will help all initiatives contribute to improve the life and the quality of care for this one. Thank you very much.
Thank you very much. And the listeners can also, if they are interested, join our network of the Women and Girls with Bleeding Disorders Working Group in EAHAD, and maybe actively contribute to this mission to improve care for women and girls with bleeding disorders.
Yeah, this was important to remind us. Thank you very much.